I started becoming interested in nursing when I was a volunteer. I was 14 years old. I worked at Sinai Hospital in Michigan, and my aunt was a patient. And she got very sick, and I figured, I'm not able to do anything. I couldn't have any control. So the first thing I said, well, I want to become a physician, because that's the way I'm going to have control. I'm going to be able to help people. I'll be able to help my people like my aunt and do it. So it became very personal for me. So then I directed my whole life career towards becoming a physician. And then I went to the service. And the first time I ever met a male nurse in the service was I met this big male nurse. I'm 6'6", he's 6'10", but he was huge. I'm like, God, look at this man. But he's a nurse. All right. Then, sure enough, he was very good at what he did. The most important skills are communication, the ability to change, the ability to identify problems, to be intuitive about things. When you say nursing intuition, there's a thing that you feel when you're with patients, but you have to be able to talk to people, be able to communicate with them, and understand and be empathetic about their feelings. Because the biggest thing that you need to know is when you put yourself in the patient's position, that's the position you want to be in. So how would I treat myself? How would I treat my family member? If you can be empathetic, if you can do that, then you'll be successful with this business. Before, a long time ago, physicians used to come in and tell you to do things, and then they would assist you. But with the change in healthcare and the change in what physicians have to do now, because they're not available to the patient population, the nurses are becoming more and more a valued part of the membership at the bedside. What I mean by that is that you have to control all of the environments. You have to take care of the patient. You have to know what the patient's medications are. You are the resource person for the patient. You provide all the patient information. You provide counseling. You provide care to the family. It's each part of those factors are what you're doing as a nurse. So as a nurse at the bedside, those are things you're going to do. Otherwise, you can go into administration. You can move into things that are healthcare related, and the cost factor for healthcare is going to affect nursing. If you like communicating with people, if you like presenting yourself forward, if you're able to care about people, the stereotypes mean nothing. And if you look at the field itself, patients are becoming more familiar with seeing male nurses. It started in World War II. It started when they were seeing male nurses out in the field. They were seeing corpsmen who moved up. Now it's increased now. We're seeing it in their everyday life. Patients react the same way. Patients are far more comfortable now when they walk into a room and they see a male nurse. They're much more acceptable of it. And they actually like it in many cases because they believe that we are able to move them around more appropriately, assist them without difficulty, and that we are able to communicate to them about different issues. And also it makes it more comfortable for a lot of the male patients when there's personal issues that they have to discuss. In this, you are literally just that bit below a physician because of what you have to do is you have to diagnose what's happening with the patient at the earliest stage in order to react to it, in order to get a response so that you can take care of the patient. The biggest thing is you have to work so hard to make sure you know what's happening with the patient that you have to have a huge knowledge base to do it. And that's all. I mean, that's the most surprising thing. Most members are surprised that when they walk in, nurses don't say to physicians, I need orders. They don't say to a physician, can you give me orders? They say, I need orders for this. So what they're telling the physician is, you need to do A, B, C, D, and E. I need orders for it because I can't do those orders. But this is what we're going to do as a process. That's the most surprising things the family members look at. They go, oh, you tell the physician what you need? Yes. It's not them coming in and telling me, I'm the one who's here with you. I need to know what you need to get fixed. So I tell them what I need. In high school, I would tell them to do 3 things. First, I would tell them to volunteer with any local organization to see whether or not they can handle the environment, walking in the environment with the patients. As a volunteer, you go and you help and you assist. You go to different areas. You live in the hospital environment. The second thing I would tell them to do is gear their programs towards biology, chemistry, those kind of programs that look to give you multiple options in terms of looking at nursing as a career, in terms of looking at it as a career. And then after they do those two things, just go to colleges. Just go over to colleges and see what their nursing programs consist of and what they have in terms of programs to prepare and what's their entry level, what do they need for their entry level, how hard is it to get into. We have a lot of waiting lists for nursing programs, and what is the requirements to get into the programs. And we have an education department here that coordinates with a lot of the school programs, and we try and bring in a lot of volunteers. Volunteering in facility lets people know you. It lets people get to know you earlier. That is a big in into giving you the basis to do it.